Today is World Sjögren's Day, and yes, we need to talk. I am Dr. Geetha Iyer, Medical Director at Code Eye Care in T Nagar, Chennai. Did you know that rheumatoid arthritis can affect your eyes? That it can cause dryness so severe that your tears may not flow even when you cry or you cut onions. Have you heard of Sjögren's disease? If not, it is time you did. And if you have, it is time for awareness.
There is a connection between the eye and the joints. The tear glands get affected by the white blood cells called lymphocytes, and they damage the tear glands as well as the salivary glands, resulting in damage to these glands, causing dryness of the eyes and mouth. The patients with arthritis, we always refer them to the ophthalmologist so that there is no damage. So it's better not to turn a blind eye to these problems. Take help, seek remedy. Thank you.
Hello everyone. I am Dr. Bhaskar Srinivasan, Medical Director at Code Eye Care, T Nagar, Chennai. And today I'm going to share with you some facts about Sjögren's disease. Sjögren's is an autoimmune condition that was first described by Swedish ophthalmologist, and this involves a triad of dry eyes, dry mouth and joint pains. It can occur by its own or along with other conditions like rheumatoid arthritis or lupus. It doesn't just affect the joints, it can affect your eyes, mouth and even other organs.
What we call it as Sika syndrome, dry eyes, dry mouth, dry throat, dry skin. It affects all the glands which form secretions which become dry. To improve awareness at a very early stage, to pick up the disease early and to help the people affected, and also to improve the research so that better options are offered to patients who are affected with Sjögren's disease.
There is no fixed order. For some, the first sign shows up in the eyes, because your eyes are not just windows to the outside world. They can be the first window to a deeper problem inside you.
Sjögren's disease or Sjögren's syndrome is an autoimmune disease which is mostly neglected by most of the patients because of the subtle symptoms like dry eyes and dry mouth. So early diagnosis is essential to prevent further complications and to save your eye. It can affect your lungs or nerves sometimes. So if you have dry eyes, don't neglect, don't ignore, consult an ophthalmic surgeon.
You might not feel any symptoms in your eye, but that doesn't mean all is well, because dryness can gradually creep in and it shows up only when there has been significant damage. On the other hand, when you have symptoms, severe symptoms, and you feel dryness, burning or pain, please know you do not have to live with it. There are treatment options, and the earlier we catch it, the easier it is to manage and protect your sight.
It's more common in females, particularly middle-aged to elderly females. Do some basic immunological investigations like anti-nuclear antibody or rheumatoid factor to confirm the diagnosis. Why this is important is, though it remains mild and many times is being underdiagnosed, rarely it can involve the other organs like the lungs, the kidney. Sometimes you can have a protein or excess potassium excretion in the urine.
One more thing that is really important. Don't stop medications just because your joints feel better, and definitely not based on something you saw online, not based on something that your friend or family member suggested. Autoimmune diseases don't just go away. They need consistent monitoring and long-term treatment, and that treatment protects not just your joints, it protects your eyes.
Sjögren's syndrome, which is the most common connective tissue disease in the world, and it is often not diagnosed very well because of various different manifestations. Therefore, a strong interdisciplinary approach with ophthalmologists, dentists, pulmonologists and kidney specialists is of paramount importance to diagnose it early and treat effectively.
So if you or someone you care about has Sjögren's or RA, share this, because when we catch it early, we can manage the dry eye, we can protect your vision, and we can restore comfort.
This World Sjögren's Day, let us spread the word. Don't suffer in silence. Don't ignore the connection. Don't mistake relief for recovery. July is Dry Eye Awareness Month, and today is World Sjögren's Day. What an opportune moment that all the rheumatologists and we dry eye specialists and ophthalmologists have all come here on a single platform to create awareness and educate all of you about such an important condition called Sjögren's disease. Come together to provide you with integrated care where we treat you not in parts but as a person.